Well, welcome back, everyone. You know, today we're diving into a topic that affects millions of people every day, which is chronic pain. So if you or maybe a loved one are struggling with ongoing pain, understanding its causes and its treatment options is key to improving the quality of life. So joining us today is Dr. Aleksey Prok from Lima Memorial Health System, Spine Neurosurgery and Pain Management. So Dr. Prok, thank you so much for being here today.
Good morning. Thanks for having me.
Yeah, so what exactly is the definition of chronic pain?
The current definition of chronic pain is a pain lasting over 3 months. Until very recently, it was 6 months duration, but now it's a pain lasting over 3 months.
Okay, so that's a long time. So what are some of the most common conditions that lead to chronic pain?
There's too numerous to list them all, but arthritis, cancer treatments, previous surgeries, headaches, diabetes, shingles, and list goes on.
Yeah, there's obviously a lot of things that do cause that. So how does maybe you and your team at Lima Memorial, how do you approach treatment for chronic pain?
Well, it starts with a visit when we discuss what bothers patient. We examine them, we review their labs, x-rays, maybe advanced imaging studies like MRIs or CAT scans, nerve studies. We ask patient what they believe their biggest problem is, because sometimes what we think a problem is not what the patient think the problem is. And then we have to consider a million other problems that accompany chronic pain, such as loss of the job and income, rejection from family and friends. It is estimated that 75 to 80% of people in the pain management clinics have psychological or psychiatric problems. They usually affect sleep, weight gain, loss of function, etc.
Yeah, so lots of variables there. So for someone that may be watching right now who may be experiencing chronic pain themselves, what do you would say would be the first step that they should take?
Well, I think the first step is to talk to the primary provider or a specialist that are involved in their care. Usually, if they have a cancer, there's an oncologist who understands long-term effects of chemotherapy or radiation. Generally, surgeon understands that some issues cannot be all fixed by surgery. There are, diabetes, so there may be rheumatologist involved, endocrinologist involved, arthritis, and other connective tissue disease, rheumatology, and so on, so on. So should be a start to discuss the problem with the provider who takes care of the immediate or the main problem.
Right. So, all right, doctor, hopefully, those people out there aren't suffering from pain, but if they are, then now they know what to do. So thank you so much for joining us today. I really appreciate that.
Thanks for having me, and have a great day.
Thank you. Well, don't go away, because we have more when we return.